Hello there everyone, myself Dr. Sahil Patel, a consultant homeopath. So today we are going to see and discuss about a thing which is from book of Dr. Borland. Borland sir has written Materia Medica, his other books on therapeutics for mothers. Even Borland sir has described about digestive drugs which especially act upon the digestive system of the patient, as well as he has also denoted children's types in various forms, that these are certain features of a child which represents himself as a calcarea child or a kali or potassium child and all those things, Baraita child and all those things. So I have taken the topic regarding the injuries and emergencies which actually happen in the acute conditions, but then also homeopathic management can also be done for the patient, where the emergency level of treatment is not available and when the patient comes to you directly. So first topic is sprains and dislocations. What are sprains and dislocations? These are most generally the wears and tear-ups of the muscular parts of the body. If it is tendon, if it is muscular portion, and sometimes it may be bony fracture also. So today I am only going to conclude that in what conditions, in which type of sprains and dislocations, which medicines are to be given. So in the most commonest minor surgical complaints, we see the sprains, fractures, dislocations, which are typically seen in many daily to daily basis of our lifestyle. In homeopathy, generally, patients do not come directly to you for such things. They just take painkillers for the complaints of their troubles. But what if a patient comes to you and just treating a single patient will lead or boost your own confidence as well as your practice, as this doctor or this physician is having also a good hold giving homeopathic medicine in such cases. So what can we do in such type of patients? First thing is that pain management can be done, and second is that we can shorten the disability of the patient. Why? Because if a disability starts developing, then patient will be having a problem in his or her daily to daily routine life, right? So period of disability can be reduced by giving homeopathic treatment. If after an accident with a general aching pain, if it is present in the body, whether it is because of the sprain, dislocation, or any kind of fracture where the part feels bruised sensation, and any kind of movement, minor movement also is painful for the patient, then what is the remedy that can be given? As we all know, all the physicians will be thinking of a single remedy for such condition, and that is Arnica montana. It can be prescribed in 30th or 200 potency as per your experience, your observation in the patient. Then what happens next? Do you really think that only arnica is to be given in all the conditions of sprains and dislocations? No. We will be discussing about 3 to 4 other remedies which really work very well in specific conditions of sprains and dislocations. Just observing those symptoms, just making a differentiation of those remedies will really help us out to cure those cases. The next thing is that after a dislocation has been reduced, but there is still pain which is present around that dislocated joint or at the sprain which was present. But what happens? The patient's pain increases when the patient is still, and the stiffness occurs when the patient is not moving. But as soon as the patient starts moving, or the movement or the motion is done, then the patient is getting relieved, or patient feels that his joint pain is better because of the movement. So the second remedy will be guessed right by you, and that is Rus toxicodendron. It is one of the very good remedies in such conditions where muscular pains are present, which can be because of the after effects of dislocations or after effects of the fractures. Rus tox can also be given. 30C potency or higher potency can also be prescribed to your patient. Even in acute cases also these remedies can be given. So next thing is that another allied condition with the sprain is dislocation or the rupture of the muscle. Then there are some indications of Arnica montana remedy. where you can prescribe. But what happens when there are sharp pains in those torn muscles? Then what will you give? Bruised feeling is present in the patient. You will also think that arnica can be given. But after giving arnica to your patient repeatedly, 30C potency is being given every 15 to 20 minutes. Some physicians give water potency also to their patients to get fast relief. But it doesn't work. What will you do? Those sharp pains are specificity of the Bryonia alba remedy. You can give Bryonia alba medicine 30th potency or the higher potency to your patient for this specific conditions, and few more doses of the Bryonia will literally help this patient out in this sprainy condition for his complaints. So this was Bryonia. What now if we meet more commonly a back strain where the person has lifted many heavy things in a single sitting or in a single day? If a person is going to gym, or even if a person is a farm worker or laborer, if his complaints are like that, he is having a great back pain because he or she lifted something too heavy. So this is one of the main complaints which are seen in our general day-to-day practice life. If you are practicing in the rural area, then you will see this type of symptoms present in the patients. So here also giving arnica is good, but Bryonia will actually help such patients very much better than the arnica montana. You have to individualize the case. Actually it is needed, but Bryonia works well for those conditions. Then next is in sprain with Rustox symptoms. If the symptom is present and if you observe that the patient is having stiffening up or the pain is increasing when the patient is at rest, and the person complains that during the moment or when the person is walking, literally the pain goes up, it is ameliorated by walking up. This is typical symptom of Rustox, but there is another remedy which really works very well in such conditions. So in the typical warm blooded or the gentle patients, pulsatilla can be used more effectively than Rustox. Pulsatilla also has the exactly same modalities as the Rustox, as it stiffens up in the same way as the Rustox modalities. And if the person doesn't get better by prescribing Rustox, so you can write it out that if Rustox is not working for its modalities, then pulsatilla can be given to that patient for better treatment of him. Then what about pulsatilla patients? Their sprains are actually more likely of loose jointed type, and they have a tendency to get sprains. It is one of the characteristic female remedy. It is not specially female remedy. Even males are given pulsatilla remedy for such conditions. But the feminine character, sometimes the clumsy character is represented in those males and females, so that we can observe that they have tendency to get sprains. Why? Because of their feminine character or the constitutional character which is running in the back of the picture. So pulsatilla can be given in those patients. In spite of Rustox symptoms, Rustox does not act in typical warm-blooded gentle pulsatilla types. With persistent stiffness and weakness after sprains in the neighborhood of a joint, which remedy can be given? A short-acting remedy which is named as Ruta can also be given in this patient. And Ruta has very much the Rustox modalities, but the muscles tend to get stiff when not in use and to become easier with the use. So Ruta 30 potency is also be given for such patients. If you are differentiating your patient, if a person is having joint pain and if you think that constitutional remedy is some another type of remedy, then you can prescribe that remedy on the basis of every repetition, on the basis of every 7 days or 15 days of treatment. But in the background you can prescribe Ruta remedy in 30th potency, TDS or BD for this patient for his specific pain related complaints. I am not saying that you have to prescribe 3-4 remedies on the same time, but what happens, a deep acting remedy is to be given to a patient, but the acute flare-ups which are presented in the person's body should also be treated with a smaller or shorter acting remedy like Ruta. And Ruta is also very good remedy along with Rustox. Rustox is a deeper acting remedy. The next thing is that with a loose joint which tends to turn over and is a weak, when the ankle weakness is seen, when the ligaments are not strong enough to hold the ankle joint, then calcium metabolism is affected. So which remedy can be given? Calcarea carb can be given to those patients, especially in children. If you know, if the parent is saying that this child is running here and there, but what happens, he easily gets sprains, his ligaments get tear ups. Now in ligament pains, painkiller work very good, but it takes much more time than giving just a calcarea carb doses. Even in the biochemic portions, it also helps to strengthen those ligaments, as well as the pain or the palliative treatment of that pain can also be done with this remedy. The next condition comes where the looseness and the weakness of the joint is accompanied by a certain amount of stiffness, as well as being easily dislocated. So this is to be understood. The person is having looseness and weakness of the joint. Along with the looseness, there is certain amount of stiffness, which means that during the motion, person is having pain. Even his muscular portions are weak and loose, and it is tendency that those joints easily get dislocated. Then few doses of strontium carb can be given. You can read this remedy from Allen's keynote and William Borik's Materia Medica. The symptoms of this remedy for those joints are especially given there. A patient who had received treatment for repeated subluxation of right sacroiliac joint. If you know the hip joint, sacroiliac joint, without benefit, the person has given the treatment for subluxation of that joint, sacroiliac joint. Then what was given? At the end, strontium carb was given, and the patient had better, because the subluxation occurred when she had the brake on the car. She was also forbidden to drive for 2 months. See, this was the effect of this remedy, and after giving this remedy, all the further troubles were gone away from that patient. So it is one of the good remedy which works on the hip joint. So you can take a note of that. Then another thing is that muscular fatigue or general exhaustion from walking too far or driving too long can be helped by having a hot bath, right? But what can enhance your hot bath? Just few or 2-3 tablespoons of arnica mother tincture. You can give your patient. If a person is having a complaint that my legs are having much pain because I have to drive for longer period of time, this is also general condition which you can observe in your family members, even it can be felt by you, then you can add 2-3 tablespoons of arnica mother tincture in your water bath and a hot water. Then it will definitely make your system relaxed, muscular system. This is mostly observed that hot water bath helps us. The next is that for synovial effusion into the tendon sheath or the patella joint, where pre-patella bursa or the ganglion of the wrist which is formed, there is a specific remedy which we all know. I have also discussed that remedy is Ruta. Ruta can be given. It is almost specific remedy in wrist ganglion, pre-patellar bursa, or any kind of synovial fluid effusion. This remedy can be given. But there are some conditions where synovial effusion, which leads to extreme inflammation of the joint or extreme burning pain, burning sensation for the patient, where patient cannot be still. The patient gets irritated and impatient in each and every condition. And these conditions, another remedy can be given where Ruta doesn't work. The second remedy works is Apis mellifica. As we all know, Apis mellifica is almost a specific remedy working on synovial joints of the body, especially near the region of our knee joint, where pre-patellar bursa is having accumulation of the synovial fluid. So this was the topic from the injuries and emergencies of Dr. Borland's book, and we have discussed about sprains and dislocations. In the next